Hi there, everyone. So we are coming to you today. We are streaming live. Well, at least I really hope we're streaming live because I'm clicking a button over the side here for us to go live on Instagram. And to be completely honest, I don't know if it's working. It's working. It is working. Woohoo! Okay, see, I'm a pediatric nurse. I'm not a tech whiz. I'm really not. But today we are talking about sepsis in babies and children. So particularly what we're going to be talking about is, what is sepsis? What are the signs and symptoms? But we're also talking about advocating for your child and how to talk to healthcare professionals about your unwell child. And we have a whole lot of resources, which is incredibly important because, we've got all of these different things that you can use and you can share so you know what to look for in your unwell child. Now, I'm coming to you from Land today. What I would love is that if you can pop some comments below, please let me know that the technology is working because Meagan and I have had a few tech difficulties this morning. We've been trying to get on, but we think everything's working now. Even just a thumbs up or a wave would be fantastic. And we're streaming across multiple platforms today. So across Instagram, Facebook, and YouTube. And guess what? You can ask questions. So if you have any questions about what we're talking about, then please pop them in the comments below. Okay, so my name is Sarah Hunstead. I am a paediatric nurse, mum of two, and founder of CPR Kids. And I'm coming to you from Land today, and I am joined by the fabulous Meagan O'Keefe from the Queensland Paediatric Sepsis Program. So Meagan, please tell us about yourself.
Sure thing. Thank you so much, Sarah. I'm so excited to be here today. As you mentioned, I'm one of the social workers on the Queensland Paediatric Sepsis Program. We're a statewide program of a bunch of incredible clinicians who work to really get the word out there about sepsis, educate community and educate doctors and nurses and other clinicians around what sepsis is, how to catch it early, and how to treat and manage sepsis. With the underpinning goal here is to get rid of sepsis altogether. That's the dream. But in the meantime, to really try and lessen the impact of sepsis on children and on their families. So as the social worker on that team, I have been incredibly lucky to partner with some amazing parents of children who have had sepsis. And together we have developed a family support program. So that's there once again to kind of educate the community on what sepsis is, but really to support those families who have in some way or another been impacted by their child having sepsis. And so we've developed some incredible resources and connections and, just other supports to really try and once again lessen that impact of sepsis on families. And before all of this, I worked in the intensive care unit at the primary kids hospital here in Brisbane. So, have really worked with families from that point of arriving at hospital with a really unwell supporting them through not only sort of the stress and the grief that comes with having a really unwell child, but also how to really advocate and, find their way through this healthcare system, which can often feel pretty daunting and scary when it's not somewhere that you go regularly. So that's my social worker hat. And then I'm also a mum of two little girls. So 1 and 3. So I'm right in the thick of wild times and
yes,
right
you
in
are.
the thick of little ones being unwell regularly.
Yep, you certainly are. That's it. Yep, the 9 to 10 illnesses a year are certainly where you are at the moment.
Absolutely. And I'm mindful my AirPods have just stopped working. Can you still hear me? All good?
Can hear you. Yes, no problems. Right. We're all good there. Okay. So I'm on the opposite end. I've got teenagers. And they swap between feral and fantastic. So,
look,
same with toddlers, I suppose.
I think they're right there as well.
Exactly. So it's Paediatric Sepsis Week, and that's why we're here. So Paediatric Sepsis Week is an international initiative of the Sepsis Alliance. And it provides us with such a fantastic opportunity such as this to raise awareness of sepsis. And that's, this year from April 21 to 27. So there's lots of different things going on, this being just one of them. But I think probably the logical place to start, and what I want all of our viewers to remember as well, is that we have some fantastic video resources from the Queensland Paediatric Sepsis Program that goes a deep dive into the clinical aspects of sepsis. And I will be putting the link to that in our YouTube and Facebook comments, and I will pop that in our Instagram comments as well once we're done. So we do that deep dive as well. But today, I think that, a logical place to start with is, what is sepsis? So that's certainly something that both of us can talk about, but I would love to hear your description of that.
Yeah, definitely. And I think, disclaimer there that I'm giving my my social worker and mum of two version of my understanding of sepsis, because we know that sepsis can feel really confusing, for a lot of people. So sepsis is when, it starts with any infection in the body, just any infection that we can get, and that can be viral or bacterial. We're talking flu, we're talking UTIs, just those really common infections that we get. But in our body's attempt to fight that infection, it kind of has this haywire response, and it gets a bit overwhelmed, and unfortunately starts to attack, our main organs within our body. So as you can imagine, when that starts happening, we can get very unwell very quickly.
Yeah, exactly. That was an absolutely fantastic description. You can tell that you live and breathe sepsis, Meagan, with your work. Absolutely. And I think that, often as, doctors and nurses, we can sometimes do a deep dive into, all of the ins and outs of, of what sepsis is. But the way that you've described it is what parents need to know. It's what families need to know. So that's such a good description. And the thing that we really want everybody to do, certainly is, and we're going to put links to this as well, is that we want you to download the resources, and particularly this poster. So this is the Queensland Health, so the Children's Health Queensland. Sorry, I always mix that up. I'm here in New South Wales. My apologies. We really want you to download this, and this has an incredible checklist on the back. This is a checklist of the signs and symptoms that if your child is unwell and you're thinking to yourself, I'm not quite sure what's going on here, asking that question, could this be sepsis? And going through this checklist is really important. We want this on everybody's fridge in Australia, basically.
Yes,
so
absolutely.
we will put the link to this, but this is an incredible list of signs and symptoms. So one thing to remember with the signs and symptoms of sepsis as well is that it can actually look like a flu, or like a nasty viral illness. It doesn't have this incredible set of its very own symptoms that make you go, yes, that's sepsis right there. Not only is that tricky for families, but it's tricky for clinicians as well, who to diagnose this. And I guess that's why I'm so glad that we get to ask you these questions today, Meagan, because being able to advocate for your child and to speak with the clinicians about what you feel like is going on is really important. But if you're happy, we might just go through just the signs and symptoms now of sepsis, and then I might have a chat about what you think is really important for parents to know when talking to healthcare professionals about their child who is unwell, if that's okay.
Yeah,
okay.
That sounds
very
great.
good. Do you want to go through the signs and symptoms, or do you want me to?
Should we have a little? We'll share it.
Okay.
I'll start.
All right. You go first.
So I think, as we sort of mentioned before, that sepsis can feel really confusing. It can feel really overwhelming and really big. But I think what we want to do today is just try and simplify it a little bit, and just kind of, touch on some of these signs and symptoms for you to have on your mind. But then we kind of want to, which we'll start talking about in a little while, is, really tapping into that sort of gut instinct as a parent, and going that, yes, I've heard of these signs and symptoms, but what's really going on for me here is something feels different. Something feels more than just those common cold and flu symptoms that perhaps my child's had in the past. Because as Sarah said, like sepsis really can mimic those really common infections that your child may have. So I think, you know, some really ones for us to be mindful of are if your child is feeling, you know, quite floppy, you know, you know, they might still be up and about depending on their age. They might still be moving around, but they just seem floppy. They just seem really lethargic. And, you know, that's going on for a period of time. It's not just that they're tired, it's before their nap. It's at all of those stages throughout the day, they just seem floppy. And then I think another one that you've probably heard of before is this rash that just doesn't go away. So, you know, the ones where you get the glass and you push it up against their skin and looking through the glass, you can still see some rash there. That's a real concerning symptom. Cold skin, you know, they may have a fever and they're running hot and they just seem really, you know, feeling like a really lousy with a fever, but then you start to feel their hands and their toes and those extremities are feeling really cold and you go, these things don't really match up there. And then I guess another one that comes to mind for me is if they're really agitated, you know, they're not, you know, we all feel a bit miserable when we're sick and, you know, might not be our best selves and, you know, be really social and everything, but they're just really agitated and irritated and you're doing all of those little tips and tricks that you might usually do. You know, you've given them a nice warm bath or you've played the happy song by Imogen Heap 8 times in a row, all those things that would usually just get them to sort of calm a little bit, but nothing seems to be working. Something just feels different. So yeah, they're some for me. How about you?
Yeah, absolutely. And so I think, I think one of those things as well is that you don't need all of these symptoms. You can have even just one that's, you know, that's important. And also with that rash too, it doesn't have to be there. You may have a really sick child before that rash starts. And so don't wait for that rash is, you know, something that's really important. Some other signs and symptoms that you may notice as well is that they, you know, along with that agitation, they might actually have a lot of pain, and that's pain that might not be, you know, relieved by regular analgesia. So you find that they, you know, particularly they've got pain in their legs, you know, is that something that's, you know, might be quite unusual for them. You might find too that they might have an increased rate of breathing as well. You notice that they're kind of looks like they're breathing up a bit, like they're maybe be working a bit harder to breathe, maybe breathing a bit faster as well. They may have had a seizure, or you may notice that they're a bit more drowsy or confused. And of course, that's age dependent. Obviously, if it's a bub who's not waking for feeds, or if it's a toddler who's, you know, wanting to sleep and it's not their normal sleep time, if their behaviour's just not right. I think certainly, you know, all of these signs and symptoms are things that really need to be those red flags that you go, hang on a sec, there's something not quite right here. And asking that question, could it be sepsis? And there's so many resources that you can use. Once again, I'm going to hold this thing up because this is just awesome. Okay, so I've popped the link in the Facebook and YouTube comments, so that is there. For those of you on Instagram, you can just Google the Queensland, see, I've done it again, Children's Health Queensland. I'm not going to be invited back after this, unless I get the name right. I'm not going to be invited back.
Sarah. You're stuck with it. Even if you call us New South Wales, that's all right.
Oh dear. Yeah. So see, I just did it again. Children's Health Queensland. Google that. Could it be sepsis? The checklist, and print it out and put it on your fridge. Save it in the photos in your phone, and do that, please, please, please. Okay, and go through that checklist. You can even take that to your doctor, to your GP, to the emergency department, depending on how unwell your child is, and actually show them, you know, the tick boxes on the back and say, this is why I'm concerned. So that's a really good way of being able to articulate why. So I have a question.
Highlighting back to what you were saying before, like it is so important to know that you don't have to be ticking all of those boxes. You know, you don't have to have one from each of the signs and symptoms. You just have to have enough that it's making you go, something feels different this time, something's wrong, and I just I need to get them seen.
Yeah, absolutely. And it's really interesting how hearing you say that when we've done this in these videos in the past with parents whose children have had sepsis and so on.
Yeah.
One of the themes that we keep hearing is that it was different to a normal illness. They
Yeah.
weren't getting better. They were getting worse. Their signs and symptoms were worse. That spidey sense that you get here was going off, just going, hang on a sec, something is not right here. And
Yeah.
that was really important. But that's all well and good to say, I feel like something's wrong. But what do you think is important for parents to know or carers to know when talking to healthcare professionals about their child when their child's unwell?
Yeah, and I think, this is such an important conversation for us to have, isn't it? Because even though it's sort of part and parcel of, having a child, being a parent, is that they're going to get sick, they're going to become, have get injured, they're going to need to go to the hospital or GPs. Just because it's something that is, maybe something we do regularly, or it's something that is what we do as parents, it doesn't mean that we feel really comfortable with it. It doesn't feel that it just comes natural to know how to really communicate what's going on for our child and advocate for them. So I think it is really important that we do have this conversation. And I think the place that I really want to start, and you've probably heard this 100 times over, and I apologize, you will hear it another 100 times by the end of our chat. But this is this saying that you are the expert in your child. I want you walking into those doors of your GP, of your hospital, to walk in with that genuine belief that you are the expert in your child. And so what do we mean by that? As I said, you've probably heard it so many times before, but what I mean by that is that nobody in this world knows your child how you know your child, So of course, we seek the medical expertise of doctors and nurses, because that is their field, and they absolutely that is their expertise. They are going to know these medical conditions, but no one will know your child in the expert way that you do. So you will know all of their norms, all of their their little quirks, what their thresholds are, and we've kind of talked about, like you just touched on then with sleeping. That's a perfect example. You may go into hospital and say, yep, they've got these flu-like symptoms, which they've had 7 times before, but this time they're just sleeping so much more. They seem really drowsy, and they had a nap at 9 a.m. and that's just something that's sitting really different for you, and you may get a bit of a response of, yeah, okay, like that's something for us to be mindful of, but they're 2 years old and they're sick, so that's really common. But that's when you can say, well, yes, that is common for a 2-year-old. It's not common for my 2-year-old, because I know my child, I know them inside and out. And this is the child, and I speak from personal experience here, that was born with that, the minimal need for sleep, that can function on a broken night, be bouncing off the walls till 8 p.m. the next night. Or when they're sick, they have a bit of Panadol, and that gives them that little boost that they need, and they don't need that extra sleep. So while it is normal for a lot of children, it's not normal for my child. That's that expertise that you're bringing to the table. And I guess that kind of then also moves me into this next thing that I really want parents to be and carers to be tapping into, and that's that trust your gut notion. That, like you said before, your spidey senses are tingling. That instinct that is just sort of built within us the moment that we become a parent or a carer, to say that something feels different this time. They've been sick X amount of times from all of the daycare and school and everything, but something feels really different this time. And so raising that concern to clinicians, it's not a burden at all. You are not being a burden in speaking up. What you're actually doing is you are providing this piece to the puzzle that may just be that piece that was missing for us to really get this clear picture of what's going on for your child. So, the doctors and nurses have picked up on all these medical things that are going on, but they don't know these little parts of your child that are the real red flags for something seriously wrong here. That's where, when we talk about this, you are a member of our team. It's not this tokenistic kind of saying. It's So true. You know, we absolutely need your expertise in who your child is to match with the clinician's expertise of medical conditions to get a really clear picture for what is going on for your child.
Yep, it's an absolute team, isn't it? Yep,
Absolutely. Yeah.
absolutely. Yep, a team together, working together, yeah, for your child. And I think that's so
Yes.
important. Yeah. There are times, of course, though, where you may feel like that you need to speak up, that you need to advocate for your child, because it may be that you feel that a clinician might not have quite understood, or that you want your child to have another review, that something is even just changing. So,
Yeah.
how do you suggest to how parents do speak up like that within the team and advocate for their child?
Yeah, and that's so important to recognize that, isn't it? Because
Mm.
it's all well and good for us to sit here and go, you are well within your rights. This is, you are absolutely the person that's going to bring this information that we need and everything. But when it comes to the reality of it, a lot of people find that really difficult. I'm
Mm.
sitting here as a social worker that's had all of this experience and worked with all these parents. But then when I put my mum hat on, I've absolutely been in that situation where I've needed to kind of push back and go a bit and have a bit of a difference of opinion perhaps, or just felt like I haven't quite been heard with what my concerns are. And have instantly gone into that place of like, oh, should I, shouldn't I, am I gonna, am I just using up time and questioning all of that? So I think it's completely normal to find it difficult to do this. And that may be from your own personal experiences, someone that you know, or it just may not be within your nature. So I think it is important for us to talk through some really kind of, actual strategies of how to do that. And I think I want to start with this idea of almost like knowing the words to use. And I'm going to quickly stop there because that sounds a bit daunting and going, oh, but I don't know the medical words. I don't know all the medical terminology. And that's kind of the opposite of what I mean. What I mean is knowing the words to use to really communicate that gut instinct, So you're coming there and you're saying, I don't actually know what's wrong with them. I don't know exactly what's going on. I haven't completely got my finger on what is the problem here, but I know that something's different. I don't know what's going on here, but I know that this seems to be the sickest that they've ever been. I don't know what's going on, but as a parent, this is the most worried that I have ever been. So just bringing out that terminology there of just trying to communicate what that little feeling inside of you is saying, that something is different, something is wrong. You don't need to know exactly what that is. That's when the doctors, they step into their expertise and then they start to go, okay, well, a parent being worried, of course, is normal, coming into emergency department. I don't think you go in there if you're not worried. But a parent saying, this is the most worried I've ever been, or this seems to be the sickest that my child has ever been, that's going to raise that extra flag to go, okay, well, if this parent is this worried, then we need to look at this from a few different angles here. So then and then I think also knowing who to talk to. Hospitals and healthcare settings can be, like we said before, daunting if that's new to you and it's not something you experience all the time, which is a good thing. So I think, the first point of contact is always going to be your child's bedside nurse. They're going to really get to know your child in the time that they're looking after them. But if for whatever reason you're not feeling that connection, that communication is happening, and you're still feeling like you're not being heard and you need to raise that, then you can absolutely ask to speak to a team leader within whatever area that you're in. And, it may be that team leader that can then sort of help you to communicate your concerns to the doctor when they come around. Or outside of the medical side of things, there's usually a social worker available at a hospital. So they are incredible. I'm going to fly the social worker flag here. But they can be a really great point of contact in between, families and healthcare clinicians, just to really get that communication happening. If there's a bit of a breakdown there, or people have differences of opinions, or whatever it is, we can really get, that is our role, to sit with you and to really help to make sure that you feel heard as a parent. And, then we also can think about, if you're an Aboriginal or Torres Strait Islander person, there may be an Indigenous health liaison officer that you can connect with that can help with that cultural connection and support within hospital. But then we can also look at our personal supports as well, that the reality is we can say all these things about how you can advocate for your child and speak up, but you're going to most likely be under a considerable amount of stress. You're going to be worried for your child. And what we know about stress and the impact of it on, the way that our brain functions is that it impacts how we might communicate, and it impacts how we might process and understand and remember information. So I think it's always such a great idea where possible to consider having a support person with you. That may be a partner, that may be a great friend, someone who, has that same, they're going to advocate for your child, but they might just be that one step removed where they are able to kind of, really, really communicate what your concerns are. So you may be driving into the hospital together, or have them on speakerphone and give them a call and be like, okay, these are the things that I'm really worried about. I'm going to try and chat to the team about it when I get there, but I'm not feeling great. I'm feeling really worried. Is this something that you can actually help me with when we get there? And, social workers are great for that as well. Excellent. So, I think having those supports and knowing who to talk to is another really important strategy. And then I think, preparing, writing some notes in your phone, once again, that just really helps with how our memory might be working at that time, having it written there in black and white. And, maybe even things like asking to speak to your child's doctor or nurse away from your child, that your child may seem like they're sitting there and, they're deep in the world of Bluey and seem to be okay, but that your child is actually a very emotional and sensitive child that is probably picking up on everything being said around them. And it would just be easier for you to really convey what your worries are for your child away from them. So you may ask to go to a private room while someone else sits with your child for a few minutes, just to really make sure that you're getting that opportunity to really lay on the table all of the things that you're worried about for your child. Yep. There are a few things that I've kind of come to mind there.
Fantastic. I think sometimes we just need to hear that, almost that we have permission to do this. Yes. In some ways, that it's okay, and it is okay. So
absolutely. And I think you mentioned it before, Sarah, that at the end of the day, everybody's working towards the same goal here, aren't we? We all want to see your child get better. We want to be able to figure out what's going on for them and get them better. So if we can think about ways that we can get that information and that communication flowing, it's only going to, it's absolutely necessary.
Yep, that's right. And it enhances that relationship too. It really strengthens that team approach, which I think is so important.
Yeah.
And I guess when it comes to sepsis as well, is particularly, perhaps early on in the illness, as we were saying, it can look like a flu. It can look like something, completely, different that your child may have had a few times before. And so sometimes children are sent home from hospital or the doctor, and they can get worse. And so if you are sent home and your child's condition changes, what should you do? If you've seen the doctor, they've said your child has a flu or something like that, you've gone home, but they're getting worse. What are you going to do?
Yeah. And how common is that? We've probably all experienced it where we've gone to the emergency department, our child's feeling really unwell. They get given that Zupa Duper in the triage room, and then all of a sudden all of those problems melt away because they're just so stoked on that Zupa Duper. And then you get home and it all starts to kick in again, and you go, why didn't you show them this there? But I think it is what I really kind of want to focus in on there is that that word, that things have changed. And because we know that this happens all the time with sepsis, that when you're in hospital and you've had that assessment done by the doctor and the nurse, and they have, very appropriately assessed that in that moment, how your child is in that moment, is that they are well enough to go home. And hopefully you've gone home with that sepsis information sheet to kind of, keep on your radar, but you've been sent home, but then something changes and they get worse, or, and I think it's also really important to notice this part, they don't get better when you think that they should. That is just as important as them getting worse. So something has changed. I think that once again, that's when you're probably going to notice that gut instinct kicking in again. You've gone home and they've gotten worse or they haven't gotten better. and something just doesn't feel right again. And you're probably going to question it and go, oh, but they've told me everything's fine. I've already been in there, you know, the time that it took and all of that. If you're anything like me, you might be a bit of a chronic overthinker and, you know, worried, is this my gut instinct or is this my fear? You know, trying to figure it all out and understand it. But I think my advice when it comes to that, and this comes from years of working with parents who have talked about that gut instinct that really kicked in or that they wish that they listened to, is if you've got any kind of sensation going on there, instead of trying to figure it out, just listen to it and just go back in. Because if you go back in and they say, no, everything's still as it was and fine and we expect your child to recover, best case scenario, isn't it? You know? Or the other side to that, they may go, no, you are absolutely right. Something has changed here and we need to start this process again. And if it's something like sepsis, they catch it early and they get treatment early. So once again, just, you know, putting that out there, that you going back in is not you being a burden to the system. You are not being a burden to that doctor or that nurse. You are bringing in, once again, what could be that missing piece of that puzzle that we needed to understand what is going on for your child. You're going back in and saying, once again, I don't know what it is, but something feels different this time and something feels worse than it ever has before. And I need you to look again and maybe even ask, could this be sepsis?
Yep, absolutely. And I think that's a really important thing, is that you can say, could this be sepsis? You absolutely can. It's a question that you absolutely can ask. And it might be that voicing that actually triggers to that clinician, well, you know, could this be sepsis? So I think that's, you know, one of those important things as well. So always you can ask that question, could this be sepsis?
Please, absolutely. And, you know, I think I've had so many parents talk to me saying, I wish I knew to ask that question. You know, or I wish I had the confidence to ask that question, because it really does, you know, we're going back to all that stuff we're talking about there, that's finding this way to get that courage to ask these things, because they're absolutely okay. I ask it all the time. Now, my daughter bumped her head recently. We went in and I think I asked it. You know, I'm just putting it out there at all opportunities to get that flag up there and have people thinking about it.
Yep, absolutely. It's so important. Now, we have a few questions actually that have popped up. So Kirsty has asked, are immunocompromised children at more risk of developing sepsis? So just to explain what immunocompromised means to people out there watching, it's when you can't fight infection as well, because your immune system could be varying different reasons isn't working as it should. So in answer to that, yes, absolutely, immunocompromised kids are at more risk of sepsis. And so I think that goes back to what you were saying, Meagan, about making sure that you're part of that team, that you're able to give that good history of your child and being able to say, my child is immunocompromised, could this be sepsis? I think it's really important. Certainly. Another question we've got is, what is the most common cause of childhood sepsis? So do you want to have a chat about that, Meagan, or shall we direct people to the Sepsis Alliance, to all of these fun facts and figures that they can have a look at?
I think we're going to pass this one on. But, you know, I think that we as we talked about before, that you can't have sepsis without infection. So when we think about those infections that children commonly get, and particularly those children sort of under 5 and our little newborn babies, it is those infections that you know, are present within the body, and then the body is having that overwhelming response to that infection for reasons that we don't know why. It has that overwhelming response and starts to affect its other organs. So, but yeah, in terms of the listing out of those actual infections, I think the Sepsis Alliance team will absolutely be able to support.
And I will put that, and of course the Sepsis Alliance, this is worldwide stats as well, so we'll pop that down in the comments below. But just be aware, as Meagan was saying, that sepsis can be caused by any infection. So it might be a cut, it might be a respiratory illness, it could be a gastro. There are loads of different ways. It's basically any way you can get an infection, you can, it can progress into sepsis. I'm not saying that to frighten you. Please don't think that. It's just one of those things that you keep in the back of your mind, that if your child is getting, more unwell, if they're getting sick, if they're showing these signs and symptoms, yes, that we're keeping that in the back of our mind for sepsis.
Yeah, and that's so important. I think we always
Mm-hmm.
find ourselves having that disclaimer that this is not to scare anybody. This is really coming from that notion that knowledge is power, and
Yes.
And we understand the difficulties that come with sepsis. As you said, Sarah, doctors and nurses understand the difficulties that come with identifying sepsis. So because they can mimic those really sort of common signs and symptoms. So if we can at the very least just have that word sepsis, on your radar, and have you feeling confident and courageous enough to potentially ask, could this be sepsis? That's really the goal here.
Absolutely. So Jessica has asked, how is sepsis diagnosed? Is it a blood test? Yep, a blood test is part of sepsis diagnosis, but it's also, the doctor, examining your child, looking at their signs and symptoms, doing other tests. It's all part of a big picture of things. But Jessica said particularly, what support is available for little ones who have a phobia of blood tests? Meagan, what should we do if our child does have that fear, but they need to have these testing done?
Yeah. Oh gosh, how common is this? And that's a very common and normal fear for little ones to have, and for a lot of adults to have as well.
Yes.
So, and I think this is probably really dependent on where you are, what hospital you're going to, or area. But because it is so common, there are often a lot of supports in place. So I know, here at our hospital, we have incredible occupational therapists who might do some, sort of therapy with kids prior to needing a blood test to sort of support them throughout that. But then there's also a lot of incredible resources online, and I don't have any on the top of my head, but can most definitely get them through to Sarah, that just gives strategies and steps for parents in how they can best support their child. So it may be around just some preparation, or having a key support with them that might be in the way of a teddy or something like that. There are lots of different strategies that have been put together by incredible occupational therapists who that most definitely can give some support around that, because it's so normal.
Absolutely. Yeah, exactly.
Yeah.
It really is. And that's why I think if we need to steer away of thinking about the sick child here and focus on the well child and medical play as well. So when your child is well, like today is a great day to start medical play with your child.
Yes.
So there's some fabulous resources from the child life therapists at the City Children's Hospital Network, and also the Royal Children's Hospital in Melbourne. Go watch their videos on procedures, read their stuff about medical play with kids, and there's lots of different places, even on Instagram, search for child life therapists. There's lots on there who have got fabulous resources to really try and help with these types of phobias. If you are in a metro hospital, ask if they have a child life therapist or an OT who can be with your child while they are having these tests, along with you, of course. And if you are in a remote or regional area that may not have this, then it's about distraction and honesty. So tell your child what is going to happen, and we're using everything that we can to help distract them and make that procedure the best it can be. But unfortunately, so particularly if there is a suspicion that it could be sepsis, the tests have to get done. So it's one of those things that has to be done, but we want to make it the best experience that we can. Okay.
Yeah.
So,
and can I just add in there as well, Sarah?
Please go for it.
Around, is there a test for sepsis? And as you've said, it's kind of a picture that doctors and nurses have to put together, isn't it? And a blood test may be part of that. And there's other sort of things that they're looking out for, and clinical signs and symptoms. But it is, another thing that they are looking for is this parental concern that we've talked about, that if you are voicing and you are communicating to them that this is, as I keep saying, the most worried I've ever been, or I feel like something is really wrong, that is another piece to that picture that they need to be able to get this diagnosis happening.
Absolutely. And thank you for clarifying that, because I don't think I did. It's not a blood test that says, yes, your child have sepsis. Okay. That's not what I meant at all. It's a picture, it's a snapshot of your child at that time. So yes. So unfortunately, wouldn't it be great if we could just look at them and go, oh,
Yeah,
you've got sepsis? That would make everything so much easier. But
absolutely.
it's
Yeah,
but
we're
no,
not there yet.
unfortunately,
Yeah.
no, not yet. That's it. So that's all the questions we have at the moment. I'm going to put a whole lot of links down below that are resources. But what I would love from you, Meagan, as we wrap up today, is what are the most important things that you want parents and carers to walk away with today?
I think, yeah, I want parents and carers to walk away with this belief that they are the experts in their children. And that in bringing that expertise to the table, that is your role within our team. You are absolutely a part of the team, and we need your expertise. We need your knowledge of your child to be able to get this picture together that potentially could be going, yeah, the picture is we think that they may have sepsis, and we can treat it early and they can have a great outcome. Because this, sepsis sounds very scary, and it can be very scary, but if it is caught early and treated early, kids can have great outcomes. I want parents and carers to really start to tap into that gut instinct and know that if the gut instinct is the thing that is bringing you to the hospital, that is absolutely okay. And using that language of, I don't know exactly what's going on, but something feels different, and something feels, something's going on that's different than it ever has been before. I think also around, if you get sent home and if things change and that's get worse or don't get better, come back.
Yes.
And lastly, I think it's around, just giving some thought to those strategies that we've talked about. And if you're needing to go into hospital, what supports can you put in place, be that through family, friends, or people at the hospital, to help you feel as comfortable as you can to be the expert for your child and to communicate your gut instincts.
Fantastic. Meagan, thank you so much for joining us today. You have been a wealth of knowledge and just so reassuring. Certainly the thing that I've heard from you is just that we are in this as a team together. The clinicians, parents, we've got to work together, and it's
absolutely.
You need to be an advocate for your child, and thank you for giving us the tools to be able to do that. So everyone, this will be posted on our YouTube channel and our Facebook page, so you can watch this at any time. You can watch the recording, it will be there. All the resources will be in the comments below, and thank you so much for joining us. We'll see you soon. Thank you, everyone.
Thank you so much. Bye.